Health Center's partnership includes Wellspring Retirement Community, the Greensboro Housing Authority, and the UNCG School of Nursing. The uniqueness of this partnership is that it's brought together both public, private, and academic organizations. These organizations have all come together to help impact the health of seniors here in Guilford County.
Wellspring is a nonprofit aging service provider in Greensboro, North Carolina. The residents here at Wellspring believe in what we're doing at the Greensboro Housing Authority's locations, and they believe in the University of North Carolina at Greensboro and the School of Nursing. They've seen how it's touched the community at large. We can do great things together so that we can continue to make not only the students' lives better, but the lives of the residents living at the Greensboro Housing Authority.
The nursing health centers were established with the Greensboro Housing Authority to provide clinical experiences for students outside of an institutional setting, such as a hospital. It also provides our faculty and students an opportunity to give back to our community by providing wellness services for the elderly.
The health centers are located in 3 locations within Greensboro Housing Authority. We are at Hampton Homes, Gateway Plaza, and Hall Towers. Right now we are working with Greensboro Housing Authority to expand to a 4th location in southeast Guilford County, Stone Ridge. The health centers this past year have seen over 2,300 resident contacts.
The partnership developed because there was an opportunity by working together to improve the health of the residents in the communities, as well as giving the opportunity for the nursing students to have hands-on experience in working with senior adults.
For students, the healthcare centers provide an opportunity to work with patients and clients of the healthcare centers in terms of determining their level of health, how to promote that health, and how to maintain that health, regardless of what your circumstances are.
I really enjoyed the experience. I think that it's really good for the residents to have a clinic on site that they can go and visit and get some quick answers. It's really helped me with my triage skills because the patient comes in and you have to know what questions you need to ask right then. You don't have time to go read it in your book or figure out what kind of things you might need to investigate. I really enjoy it. I think that the residents are all really sweet. They enjoy coming to the clinic and they enjoy letting us learn with them. So it's really helped me grow as a student. I've really had a positive experience.
I go to the clinic for my blood pressure, and I find that one time I had to, when I didn't live here, I had to go to the fire station and go to the health department or worry whether my blood pressure was up or down. So I'm glad I'm a part of their studies so that they can get a good education. And so I hope that I am helping them, because certainly they're helping me.
The single most important benefit to the residents is the opportunity to improve their health. It gives them somebody that they can communicate with, somebody that they're familiar with and comfortable with, and that they can share, what their issues are.
I moved down here because I had a colon cancer problem. I was having a problem with medical supplies. The nurses down here at the clinic, they had a list of numbers that I was able to call and get some help for some medical supplies to cut down the cost. They're very helpful.
This partnership has allowed students to expand the services that they provide here at the health centers. Students in public health, psychology, kinesiology, and interior architecture have all been able to come out to these sites at Greensboro Housing Authority and provide a service to the residents living here.
Students who are in psychosocial nursing can practice and concentrate on communication skills and developing a therapeutic relationship.
Communication really is the biggest part with developing the nurse-patient relationship. It's taught me a lot of how to get a patient to open up. It's very intriguing, and it'll help me throughout the rest of my nursing career, knowing that I can build that rapport with someone.
They have talk therapy that they let us come and talk to students for like 6 weeks every Friday. And what is really great about that for me is being able to have a conversation with someone. Let's help these residents, have a better quality of life. And I just love the clinic. It's a great gift.
I think that we do impact the residents in a lot of ways, but I really feel like it's a win-win for both students and residents.
By helping residents identify possible conditions that they may have early, students are able to counsel and work with residents to help maintain and manage these conditions.
We see different patients every day. These patients enjoy this clinic. They really take advantage of this. It's right in their neighborhood. They don't have to get in a car or go anywhere. It's real accessible.
Sometimes I get up and I go down there and get my blood sugar checked. Makes me feel good, makes me feel special. My doctor was real impressed by that. That's all she talked about. And she said, Belinda, keep going there, because that can help me on the days you don't come here. It's a learning environment, but it's fun.
The most significant thing I think that students learn is the realities of life. They leave this experience and they say, for the first time, I felt like a real nurse. That's a pretty strong statement. It says to them that the clients that they give care to value what they tell them.
Well, you know what? They discovered that I was non-diabetic and I didn't even know it. They do all the usual things, weight and blood pressure and that sort of thing. And then every once in a while they have some special tests like cholesterol test, which if I've got a question, I'll ask them about those things.
The Wellspring funding, it has provided us with additional equipment and supplies, renovation of space, but more importantly, it has provided us an opportunity to have a coordinator who can help coordinate the clinics and help work with the faculty in terms of enhancing the students' experiences.
The ultimate goal of the health centers is to help prevent emergency room services and connect residents to the appropriate services here in Guilford County.
The partnership that we have with Wellspring and Greensboro Housing Authority has really made the experience better because it's made my job a little bit easier, it's made a better learning opportunity for students, and it's benefited ultimately the residents.
And you want it to be a win-win situation. You want them to benefit and the students to benefit. And you don't want to just come and then go away. And this was to me a way of being sure we are there to stay.
Thank you, nurses, and Brother Hampton wants you to know I love each of y'all, and every day in my prayer, y'all have my prayer, my blessing. Keep up the good work.